So, for my final project, I'm going to be talking about the importance of sleep for overall health. And I'm going to introduce the topic. I'll talk about the consequences of poor sleep, some benefits of having good sleep, and then overall what can be done to improve sleep. So, this statistic will not really surprise anyone, but as you know, it's a good reminder that a third of our lives is spent sleeping, so it's important to think about how sleep affects our health and what can be done to improve our sleep. And here are some statistics. So the average person sleeps approximately 7 hours per night, but the average college student is closer to 6 hours per night. In America, 50 to 70 million Americans face chronic or ongoing sleep disorders, and 50% of US workers report feeling regularly tired throughout the workday. So now I'm going to talk a little bit about the health consequences of poor sleep. I'll go over immune system function, cognitive ability, and then physical health and perceived attractiveness. So the first thing that I'm going to talk about is diminished immune system function as a result of sleep loss. And I found a research article that explored whether sleep duration and sleep efficiency would be related to susceptibility of the common cold. In the context of the study, the researchers recruited 150 healthy men and women who reported their sleep duration and their sleep efficiency over the span of a couple of weeks before being quarantined and subsequently exposed to a rhinovirus, which is basically a form of a common cold. And the results showed that participants with less than 7 hours of sleep were nearly 3 times more likely to develop a cold than those with 8 hours or more, and participants with less than 92% sleep efficiency were nearly 6 times more likely to develop a cold than those with 98% or more sleep efficiency. And sleep loss also affects our defense mechanisms that are related to our immune system, such as reduced production of cytokines. And when you don't get enough sleep, your body produces fewer cytokines, which will weaken your immune system. And sleep loss also impacts the ability of leukocytes to produce interferons, which help fight disease and any other infections. So, sleep also affects our cognitive ability and our academic success. So, a study that I found, a recent one from 2022, examined how insufficient sleep affects mental health, cognition, brain function, and brain structure over a 2 year period in early adolescence. So, the study utilized a sample of over 8,000 participants who were roughly 9 to 10 years old from 21 different US states, and participants were categorized as having sufficient sleep or insufficient sleep on the basis of a cutoff of about 9 hours of sleep per day, which is the recommended amount for 9 to 10-year-olds. So, using propensity score matching, the researchers matched groups of participants on 11 key variables such as gender, socioeconomic status, and the results of the study found that insufficient sleep has a long lasting effect on neurocognitive development in early adolescence, and earlier sleep intervention may even improve long term development of cognitive ability. Specifically, the insufficient sleep condition, that is, those who were adolescents that were sleeping less than 9 hours per night, was associated with lower resting state functional connectivity and reduced gray matter volume when compared to the sufficient sleep group of 9 to 10-year-olds that were sleeping more than 9 hours per night. So, the second thing that I want to talk about is sleep loss can also impact academic success. And a study that I found from 2018 utilized a regression analysis to look at data from about 55,000 students. And the aim was to isolate the relative impact of sleep on GPA and the probability of withdrawing from a course. And their estimations also took into consideration other variables that would affect academic performance, such as demographics, academic factors like learning disability, drug and alcohol use, perceived stress, maybe employment hours. And the results of this study interestingly showed that sleep disturbances were a significant independent predictor of academic problems. So, on average, every additional day per week that a student experienced a sleep problem increased the probability of that student dropping a course by 10% and lowered their cumulative GPA by 0.2%. So, this quote was very interesting because I thought that was a very concrete and hard to argue with evidence. So, finally, sleep loss can have consequences in the form of physical health and perceived attractiveness. Sleep loss can affect weight in the sense that lack of sleep causes a hormonal imbalance in the body. So hormones such as leptin and ghrelin, which control appetite, are affected when one doesn't get enough sleep. So this would cause increased feelings of hunger and therefore overeating or weight gain. So sleep deprivation is also connected to growth hormone deficiency and increased cortisol levels, both of which are associated with obesity. And anyway, inadequate sleep can also hinder the body's ability to metabolize food. So in another study that I found, researchers examined the link between sleep duration and BMI among 990, almost 1,000 working adults. So these participants completed a questionnaire about their sleep habits and had their BMI measured. And the main goal of this study was to investigate the connection between their sleep duration and their BMI. And the researchers found that shorter self-reported sleep duration was negatively associated with a higher BMI while adjusting for confounding variables. So they basically found a negative correlation between sleep and higher BMI. So as the average number of hours per sleep decreased, BMI increased. And these results are consistent with findings from other age groups, and this pretty much emphasizes the importance of getting enough sleep for maintaining a healthy weight. The second thing that sleep loss can be in the form of a consequence is perceived attractiveness. And I thought this was pretty interesting in terms of social capital and how sleep can affect the way we're perceived by others. So this study from 2010 looked into whether sleep-deprived individuals were perceived as less healthy and less attractive after a sleep-deprived night compared to a normal night's sleep. So this study involved 88 participants, and 23 of them were healthy adults who were sleep-deprived and were photographed after a normal night's sleep and then after a sleep-deprived night. And these pictures were then evaluated by 65 untrained observers, and the primary result, or the primary outcome that was measured, was the difference in the observers' ratings of the perceived attractiveness of the person, the perceived health, and tiredness. And they compared sleep-deprived and well-rested individuals using a control group. So the results showed that sleep-deprived individuals were perceived as less healthy, more tired, and less attractive than when they were well rested. And these findings indicate that people are sensitive to facial cues that are related to lack of sleep, and this could have implications for social judgments or behavior. And the last thing that I want to note is that physical health and perceived attractiveness also is an umbrella for general health problems, because sleep deficiency could be connected to a variety of health issues such as heart disease, kidney disease, higher blood pressure, diabetes, strokes, obesity, and depression. So now I'll talk about 2 benefits of good sleep. Beyond energy and being awake and more focused during the day, sleep following learning has a beneficial effect on memory consolidation. So a study in 2006 aimed to investigate the impact of sleep on memory in high school students by demonstrating that sleep has a persisting effect on memory recall. So this study consisted of 2 experiments where participants were required to recall vocabulary after learning. American high school students were given English to German vocabulary list and had a time limit of 10 minutes to learn the whole list. The learning took place at either 8 a.m. or 8 p.m., and recall was tested immediately after learning as well as after 24 hours. And the memory test that they used to measure the recall was in written format, with English words given in a different order than the original presentation. So basically the 8 a.m. group was the control group, where they had to go through the entire day after learning the material, and then the 8 p.m. group, after they had finished learning the material, they went to bed, and the results showed that sleep following learning, so essentially the 8 p.m. group, showed greater memory consolidation, and that sleep improved the retention and recall by 20 to 40%. Additionally, MRI scans indicate that REM sleep helps transport information from more long-term memory storage in the hippocampus. So beyond memory, which is very interesting, sleep extension, that is just extending the amount of sleep you get per night, or possibly going to bed at an earlier time each night, sleep extension can improve cognitive performance. So a study looked at the effects of gradual sleep extension, that is earlier bedtimes, earlier sleep onset, and more time spent in bed, and basically investigated how this affected cognitive performance through a computerized test. So this study involved 55 adolescents with sleep symptoms of sleep deprivation who were randomly assigned to either a control group or a sleep extension group. And the sleep extension group was instructed to extend their sleep by gradually advancing their bedtimes by 5 minutes each night over the span of 2 weeks, while the control group received no instructions. And the study monitored the subject's sleep with an actigraphy over the course of a month, with the first week being the baseline and the last 2 weeks being the experimental weeks. So cognitive performance was assessed before and after the experimental manipulation with the computerized test. And as you can see, cognitive performance, especially visuospatial processing, speed, and accuracy in this test were significantly better than those who were not in the sleep extension group. So now that I've told you some of the health consequences and some of the benefits of sleep, what can we do about sleep loss, and what can you do to improve your sleep? So what you can do about sleep loss are thinking about the ways that you are connected to your sleep and the ways that the things that you can control. So this study found that the prevalence of poor sleep quality in college students was related to a variety of factors, being older in age, having lower subjective social status, having worse self-rated health, having lower self-reported self-esteem, higher levels of stress, and worse academic performance. So these factors may be controllable, but otherwise they may point to ways that institutions and universities could revise their policies, maybe make some interventions to promote healthier sleep habits that could ultimately enhance students' academic performance and their overall well-being. And so the last thing I want to talk about are a few tips and tricks for how you can improve your sleep. If you haven't heard this before, it's very important to be consistent. Go to bed and wake up at the same time, if possible, even on the weekends. Obviously limit caffeine, especially several hours before going to sleep. Avoid electronic screens within an hour of sleep. Have daily physical exercise at any point in the day. Make a routine for you to wind down before sleep, such as reading or maybe straightening up your room or doing some meditation. Avoid using your bed for things other than sleep, such as work or eating. You kind of want to condition yourself that when you're in your bed, you should be tired and falling asleep. And then the last point is that make sure your room is dark at a comfortable temperature, and either reduce your noise or use a noise machine to your preferences. So thank you, and here are my sources.